hearing?
You're not hearing me?
It's a little low.
All right, let me see if it's my volume. Thanks. I don't know why. All right, let me get a headset. Good evening, is this better?
Yes, it is.
Okay, good evening. As I said, my name is Roseanne Maxwell. I am the alumni coordinator at the Cave Hill campus. And this evening, our presenter is Cecelia Neblett-Brathwaite. I will introduce Ms. Neblett-Brathwaite to you. Cecelia Neblett-Brathwaite holds a master's in Administration and Management and a bachelor's with honors in social work from the University of the West Indies Cave Hill campus. Mrs. Neblett-Brathwaite also successfully completed the associate degree in marketing management, certificate in technical vocational training in adult education from Erdiston Training College in Barbados, and certificates in the paralegal and substance abuse counseling from the Barbados Community College. She's also certified in guidance and counseling from the UWI Open Campus. Ms. Neblett facilitated with the National Productivity Councils in Barbados and the Piling Creative Workshop. She has also lectured at the University of the West Indies Cave Hill and the Samuel Jackman Prescott Polytechnic. Mrs. Neblett-Brathwaite also contributes on occasion to the Better Health magazine and the International Labour Organization magazine. Good evening again, and I want to do some housekeeping. Could you please keep your mics muted as much as possible during this session? We don't want to have the feedback. And at the end of the session, we will allow you to ask any questions you may have regarding the presentation. So I'm going to share the screen now for Ms. Neblett-Brathwaite. Ms. Neblett-Brathwaite, could you go ahead and make your announcement, please?
Hi, good evening to everyone. I'm so happy that you are here this evening. This evening, we are going to be talking about COVID-19, relationships, and sex. So that's our topic for this evening, and I hope that you enjoy it. It's also going to be recorded, so I just want you to be mindful of that. You know, in our session, we want it to be dynamic. However, we must recognize, you know, there are certain guidelines to be followed. Thank you.
It also has a slant in the presentation, also on HIV. So I'm going to now start the presentation. Can everyone see that?
Yes, we can.
Okay. Are you ready, Cecelia?
Yes, please. Okay, good night, everyone, again. We're going to be talking about relationships, COVID-19, and HIV. Why I chose this topic is because, you know, COVID-19 is upon us, but we have to recognize that the fight, you know, for HIV is never over. We have to be vigilant and recognize that relationships basically would be the foundation for why we, you know, contract the HIV virus, because, you know, you're having sex sometimes unprotected, and because of the COVID-19 restrictions, sometimes, you know, it becomes necessary that, you know, I, as a behavior change specialist, conduct programs such as these to inform the public that, you know, COVID-19 is in our environment, but so is HIV. We want to just understand the dynamics of relationships so that we can make better choices. So we're going to have an interactive session today, and I hope that you really, you know, enjoy the session and you take some tidbits so that you can pass it along to friends and families and colleagues. Okay. At the end of this module, we'll be able to describe the difference between HIV infections and AIDS, explain how HIV is or is transmitted, explain the factors affecting HIV in men, explain why HIV testing is as critical as the COVID-19 test, and describe the benefits of behavior change. That's the holistic approach to the topic this evening. So we want to make sure that at the end of the session that you can understand basically the tenets of HIV and relationships in this COVID-19 environment. You know, we are going to talk about HIV. We have to set the foundation. Everybody might say, I know what is HIV, but I still like to make sure that, you know, just in case we have somebody that don't, that we go through these small areas in the topic because they're small but vital. What is HIV? HIV is only transmitted by humans, and it is immunodeficiency virus. Virus means organisms which causes illness. So that's basically what the word HIV stands for. How is it found? Bodily fluids. HIV is not present in infectious quantities. For example, you have saliva, tears, urine, feces, and vomit. We have sweat. And persons will say if HIV is found in these things, some persons will say small quantities. There are some arguments, but HIV is not present in infectious quantities in these areas. Transmission continues. HIV is a sexual transmitted infection. Sometimes we hear STIs. HIV is not as easily transmitted as other STIs. Have to be transmitted through sexual contact, orally or otherwise. HIV, the transmission of HIV is greatly facilitated by other STIs. What I mean by saying that is that if you have chlamydia or gonorrhea and you're not having protected sex, if you're having unprotected sex, then it's likely that it can elevate to HIV because you probably will become more promiscuous than gravitating towards the higher disease. You have one beverage and then you have probably a beer and then you go into, you know, the solid alcoholic beverages. So that's how you gravitate towards those things. Next slide. What is AIDS? AIDS is the acquired immunodeficiency syndrome. It is potentially life-threatening condition that causes the immunodeficiency virus by damaging your system. HIV interferes with your body's ability and to function. When persons have AIDS, for example, that is usually the last stage of HIV. HIV infects the immune system, causing damage to the body. And this is what happens. Sometimes you see persons at the last stage because of the C4 lymphatic cells. Next. And this is just some of the information that I gleaned from our HIV epidemic survey at the end of 2017. We're looking at the males here, the HIV cases, 2,669. For HIV, we have the AIDS cases, 1,837. We have the female cases, and they're actually lower. That's why we target, with our national strategic plan for HIV, we usually target males because males would be a higher number and greater risk. However, we still want to make sure that we set up programs to target our females as well, because, you know, you have male and female partnerships. We're getting to the meat of the matter now. How do individuals contract HIV? We have a lot of images there. Most individuals get HIV through sexual contact, anal, that's very risky, vaginal, oral, which is low risk, blood, and substance use. So we have all these images here. We have an older gentleman with a younger lady. We have two males. We have a male and female. We have persons taking intravenous drugs. We have a gentleman here. He's using alcohol. So these are all some of the areas that, you know, individuals can contract HIV. Next. Sex is nice, but the AIDS thing. You recognize during the COVID time, we had persons in the media. We had a gentleman in the media whereby he was with his girlfriend, and when he was caught by police going home at a late time, he said that, you know, one girlfriend put him out and he was now trying to go to the other one. So sex is nice, but the AIDS sting. We have to always remember that. And you see the person's wearing a mask because this is COVID-19. This is the COVID-19 environment. So we have to navigate our sexual practices with the COVID-19 period, because we're not going to stop having sex just because it's COVID-19. So we have to make sure that we give you this information so that you can navigate these challenging times that we're in. Yes. Love, sex, and COVID was the name of the topic. So we'll see how we tie all of these pieces together. Okay, sex talk. COVID-19 isn't a sexually transmitted disease. However, it's very important to understand the challenges that you can face because of, you know, the droplets, having sexual intercourse. You know, you have personal contact with others, you'll be kissing, that's saliva, you know, you'll be doing other, using vaginal fluids and stuff like that. It may be low risk, but you're in close proximity, you're not really 6 feet apart. So there are other ways to have this sex talk. You know, you can, persons say you can abstain for a bit, you can chat on the phone, although you receive your injection, your jab. We have to still make sure that you are mindful of the challenges that can, you know, be the challenges that you can have, you know, as a result of engaging in sexual activities during this COVID period. Why should I bother about HIV at this time, since COVID is in the air? Because it's a public health issue, as much a public health issue as the COVID-19 situation is right now. Prevention and treatment efforts, we still have to ramp up our prevention and treatment efforts. We've reduced morbidity and mortality rates, reduce the opportunities for transmission, improve the quality of life for all. So we have to make sure at the end of the day, you know, that we have to, you know, set all the boundaries that we must work with respect to HIV and STIs and relationships during this COVID period, because we have to make sure that we still enlighten the public about the risks and challenges that are out there with respect to HIV during this period, because persons are very lonely because they're all shut in and cramped in together. And sometimes this can be challenging. So what do? Resort to, you know, interactive and personal relationships and sexual relationships as well. So we want to make sure we arm you with all the information so that whatever environment you're in, you always make the right choice for yourselves at this time. Factors that can decrease risk. Correct and consistent use of condoms. Reduction in number of sexual partners and reduction in stigma, and facilitates increased HIV retention in medical care. We want to make sure that we use condoms consistently. You know, at the National HIV AIDS Commission where I work, we have a variety of condoms, you know, a variety of lubricants to make sure that we cater to all the different sectors of our population, all the different individuals that come in on a day-to-day basis. We want to make sure that we have everything there for you, that you have your choices. We want to make sure we have our dental dams in case you want to have oral sex. We want to make sure we have our literature. So these are all the things that you can do to help to reduce, you know, the risk of contracting HIV, you know, and we want to make sure that it's better stigma, that we want to make sure that we have an open door policy in our polyclinics, in our health facilities, you know, in our schools, in our areas where persons come to receive good customer service, to make sure that, you know, we decrease our risk. And when we improve our customer service, we decrease our risk. This is a good one. Condoms are cheaper than AIDS. It is true. Condoms are cheaper than AIDS. So we always recommend that in this period, we give condoms free at the National HIV AIDS Commission. We have 3 condoms per person, and we give lubricants as well. So you're free to walk in at any time in any polyclinic in Barbados so that you can access some condoms, because it's much cheaper to access these condoms than it is to acquire AIDS or HIV. Yes, ma'am. What does the HIV test mean? Positive or negative? The HIV antibodies are present when you're positive, infected and can infect others. That's when you're positive, need to be treated. That's when you have a positive result. These are all the things that would happen. When you're negative, no HIV antibodies present, cannot infect anyone. You can at times be retested, because sometimes you may get a negative, but you can be retested over a period of time, because as long as you're actively engaging in sexual activities, it's advised that you retest and retest. A popular face, Dr. Anton Bass. It is in your hands. Get tested. Everyone, no matter who they are or where they live, should have access to HIV services during COVID-19. Early diagnosis can help, and early diagnosis matters. So it's just like COVID-19, it's good to be diagnosed early, and early means that whenever you're going to engage in a sexual relationship with someone, it's good for both partners to come and have counseling pre and after to make sure that you're on the same page, and make sure that you know the status of your partner. Why you should have an HIV test. HIV test is the only way to know if your partner is positive. You can make an informed decision about how to protect yourself and the other person as well. You can plan for safe pregnancy outcomes. If positive, you can start treatment right away. This would prolong the length of time and the challenges with comorbidities and the other areas of life that, may be challenging for you if you were tested early. Benefits of early testing. HIV is a virus that weakens the immune system. Early diagnosis is appropriate and can help improve the quality of life. For men, being able to spot that you have HIV can help in getting this quick diagnosis. Early care reduces the incidences of death. So if you come to the polyclinic early, you go to your medical practitioner, you go to the QEH, this can reduce death. The earlier you go, as my granny said, the earlier, the better for you. You have to make sure that you go to the doctor as soon as you think that, you have some of your partner is probably infected, or you have a suspicion, or you just want to make sure that, you want to know what's wrong with your health. You go for diabetic checks, we go for hypertension, we go for heart tests, we go for all these things. Why not the HIV test as well, so that we can know our status? When we know our status, we can protect ourselves and our loved ones. HIV, STIs, and co-infection. When this happens to men, sometimes you have sore throat, you may have swollen lymph nodes, fatigue, skin rash. These are some of the things that would happen when you are infected with HIV. The first stage, you have acute HIV infections. Most people don't know right away when they have be infected with HIV. Sometimes you have 2 to 6 weeks after the immune system puts up a fight, but these are some of the things. Then you have the second phase of it, whereby after your immune system loses the battle with HIV, flu-like symptoms come, but there is hope, because as long as you go to the doctor, then the doctor is able to put you on the ART medication to make sure that you have a greater chance of, fighting this deadly virus. The AIDS as well, in the third stage is a symptom. AIDS is the advanced stage. And that's when, this is usually when your CD4 T cell number drops below 200 and your immune system and body is damaged, severely. So this is why we ask you to come to the doctor to make sure that, you can get your advice, you can get your counseling, you can get your treatment, and you can get your social support. Next thing. Okay, behavior of men towards sex. It is said that men are aroused by what they see, have a higher sex drive than women, take greater sex risks, do not always be emotionally connected. This would be a discussion for, I guess, when the mics are open, but I would be asking the gentlemen to tell me if these things are true, because they say that men are aroused by what they see, women are aroused by other things. So all of these are discussions that we can have at the end, looking at behavior change to see how we can change behavior. So these are some of the things that we can work our behavior strategies around. Transactional sex. What is intergenerational sex? My research officer, Nicole Drix et al. 2013 defined it in her work article. Intergenerational sex is intercourse with a person that is 10 years or older And sometimes they call them sugar daddies. You know, we have sugar mummies as well. It is a relationship between a young woman and an older man, or older man and younger woman. You have transactional sex where financial exchanges or things for material exist. And this, we had a research in 2013. We're due for another research right now at the National HIV/AIDS Commission. But this is a pertinent topic, you know, with all the things we see out there. We see persons at community and all these other areas where you see young, older persons are so vivacious and they have so much energy, and, you know, we have the money as well. So all these are things that are very important to discuss now, because we recognize that our 50 and over population, we usually focus on our 15 to 49 population with our research, but our 50 to older population is becoming very active, sexually active as well. And that is the area that I'm researching right now at university. But we want to make sure that we get this information as well, so that we can, you know, plan our programs around the 50 and older population as well, because we recognize that they're living longer, they're active as well. And we want to make sure that the transactional sex, if you're going to cater for the younger folk and you're not going to cater for the older folk, and there's transactional sex, you see where that cross comes in. So we want to make sure that we set our boundaries around all of these different target populations, so that we can have programs that cater to the needs of everybody in our segment population. We're looking here at women as well. This one at the top, it says, yes, mom, we decide to get married. I know you don't like him, but it's my decision. These are all the challenges. Think like a man. You know, we have Steve Harvey in his book. We look at the physical challenges women might have. HIV may cause some health problems to women, some gynecological challenges. You have menopause, for example, whereby, you know, persons go through menopause. That's the area sometimes between the 40 to say 50 and over period, whereby certain women becoming more vivacious, you know, they don't want to cross over. So sometimes they up their game. Men buy sports cars, women do other things. And we have challenge with the ovaries as well. You look at emotional stresses. You don't want to become 50. You don't want to become 60. So you're isolated sometimes, and it's stressful seeing those young persons strut their stuff, remembering the good old days. So these are all things that we all go through, some of the emotional challenges that we can have. And it doesn't matter where we are living in this world, we all face some of these challenges, you know, and these challenges we have to deal with where we're doing things like studying, we're wives, we're mothers, and these are things that we still must go through as women. Five emotional needs of men. Encouragement. They're saying here that we need to encourage our men because they have fragile egos. All this would tie into our behavior change process. We're looking at support. We have to support our males. We're looking at friendships, respect, and submission. These are all things that would factor into our behavior change elements. So we will see how we can merge the COVID-19 and behavior change and HIV to see how we can bring about a holistic approach to relationships. We have 5 reasons. Again, we have things that men would do. Women need to receive care, understanding, and respect, devotion, validation, reassurance. And men, they want trust, acceptance, appreciation, admiration. And all of these are things that we want to make sure that we give to each other so we can have a balance. We can have balance in the relationships. Sexual risks. We're looking at the sexual risks according to the Center for Disease Control and Prevention. We're looking at make sure that 2 to 4 weeks, we're looking at actual initial exposure. So after your initial exposure, a person who's HIV positive, you will have 2 to 4 weeks that you will start to, you know, feel the symptoms, and you may have to go to have a check done. Symptoms can continue for several weeks. Some persons, you know, we're not all the same. Some persons will catch a cold today, or some persons would get the flu, feel better in a week. Some persons may take longer. Some person may have the COVID-19 virus. They may be valid in 2 weeks. The next person might take longer. Some person might die. So these are all things to look at. Person's viral load is durably undetectable. When the viral load is undetectable, sometimes you go for at least 6 months or could be undetectable for longer. This means that most people would need to be on treatment for 7 to 5 months. These are all things that we must understand, because, you know, you might say, hey, that person looks really healthy, or my partner looks really healthy. That is why it's advisable to get a HIV test, because knowledge is power. You can only know what is happening in your body if you have an HIV test. Behavior change in men and women. This thing is very hard. This thing is so hard. This thing is hard work, because behavior change is a difficult process. You know, when we're looking at behavior change, it's no easy thing. You know, it's a ladder. I don't know if you can see all these slides, but we look at the first stage. When we're looking at behavior change, we look at it's a process, and it's a very difficult process. And as behavior change specialists, it's a very difficult thing to do. I think there's only probably 1 or 2 in Barbados right now practicing. But we look at the first stage, and you have no intentions to change. It's called the pre-contemplation stage. Right now, I don't really have any intentions to change. Just ladies on the talking about HIV and behavior change, but I don't really have any intention to change. I ain't contemplating it. So pre-contemplation, I have no behavior to change. Then you tell yourself, you know what? I have some children at home. I'm married. I'm at University of the West Indies studying and looking for mobility. So let me consider it, because there's something in this presentation that triggered something in my mind. I think I'll consider it. Then you have the preparation stage, saying the benefits. What are the benefits? You know, if I have one partner, you know, I stay healthier. There's less stress, like the gentleman that we heard in the news where he was evicted from his girlfriend. So it's less stress. You know, we start to acknowledge all these things. I'm looking to do my master's now. You know, I need to have some support from a wife or a girlfriend or a boyfriend or a female. The action stage. I can't talk about this anymore. So in the action stage, persons might be just ready to take action. I have to take action. So I have to take stock of my life. I'm going to find a coach. I'm going to get some counseling. I'm going to talk to the pastor. I'm going to talk to mom. I'm going to talk to my wife. I'm going to talk to my children to see how best I can work through my issues. Or I'm going to just sit down and reflect. Maintaining. To maintain, this is very difficult, because you have to avoid the former things. You have to avoid, let's say, I've been going out with the guys at night and drinking, and, you know, everybody there has 2 and 3 girlfriends. So this is where I'm at. So sometimes we have to avoid the challenges of bad company. But, you know, you relapse, like everything else, you relapse. You decide, okay, hey, look, I'm going to study 4 hours a day. And the day gets away from you, so you relapse. But you have to get back on your horse again. You have to make sure that, you know, you have a target, you have goals and objectives, and that is what you have to do. We're looking, this is the stages of behavior change. So we have to make sure that during this, when we have these stages, that we follow up on each and every stage, because each and every stage is important when we're looking at relationships, and we're looking at the relationship dynamic to success. We want to make sure it's a high ladder. We're going high up on the ladder, and it takes time, and it takes energy, and it takes patience. But when we're looking at behavior change, these are all the factors that come into play. When these factors come into play, sometimes we need a wider umbrella. We're looking at policy development. As with COVID, you know, you had your one-on-one, wear the mask, but sometimes now we have to look at policy development. I listened to the news tonight, and they were talking about things like, you know, if it is legal or illegal to tell persons to have an HIV test. So this policy, that's where policy development or program development and change of beliefs comes in, because when I change looking at beliefs, looking at all these things that we as a Caribbean people are accustomed to, we're accustomed to, you know, sugar daddies, persons having more than one girlfriend, and that's okay. You know, persons that may be unemployed, may be at the mercy of the person who is working in the household. So these are all things that we are accustomed to. So it may not seem damaging to us at this time, but because there are beliefs that they just may be in this time of HIV and STIs. We are stronger with knowledge. That's why I always say that knowledge is power. We are always stronger with knowledge. That's why it's good to come out to the seminars, get all the information you can get. I know persons that say HIV is daunting, relationships is a daunting task. I know COVID-19, but it's good to understand how they play, how they interact with each other to see how best you can navigate these challenging times. Okay, I want to say thank you. At the end of the session, I just want to recap for you because we're looking at the COVID-19. We're looking at, having relationships where we didn't talk about abstinence, but abstinence is also very important in the COVID-19 experience. You can abstain. We're looking at the different types of relationships. We have the marriage, we have the visiting, we have the common law. All these are different relationships, which would have different dynamics. We're looking here at what you can do to engage. You can have walks, you can have chats, you can have other things. And at this time where sometimes we may have lockdowns again, hopefully not. And other areas of your life, they may have lockdowns in other countries. Maybe you're traveling for work or what have you. You have to make sure that you understand your partner, you understand what your partner is thinking, you understand the challenges, you understand what isolation does to relationship. And all these are different issues that will play into you experiencing risky behavior in your situations, in your relationships, because at this time we want to make sure we have a healthy Caribbean, a healthy Barbados, a healthy world. So all of these are small issues that we must flesh out to make sure that persons understand that the HIV virus is still here. COVID-19 is not going anywhere in any hurry. And we have to make sure that we give persons all the information, no matter how bitter the pill is, to make sure that we provide all the information necessary for them to make wise and healthy choices during this time. So if you want to, I leave it up to any questions. I don't know if I want to say thank you very much to Roseanne for facilitating me this evening and her team. And I want to say thank you to all of the persons that came on this evening to share in the seminar. And I want to encourage you to continue to come on at night to just be a part of our sessions because they're very informative and I should be of some benefit and use to you in your daily life. So I want to say thank you again for being a part of this seminar tonight.
All right, good night. Thanks, everyone. I'm seeing some comments in the chat, Cecelia, specifically asking persons were saying that they expected a little more about relationships. Okay. And I know that in COVID-19, there have been persons who would not have been staying in a home with each other over a period of time because husbands and wives, they go out, they come in. But now they were in a position where they were constantly spending 24 hours together, which was not necessarily a case. How has that impacted on relationships in terms of the space that you're used to not having it anymore and dealing with the COVID-19 environment?
Yes, good question. Yes. Persons were not accustomed to spending this length of time with their partners. We live very busy lives, so you recognize that, the males are out a lot more, while females take care of the home, or sometimes vice versa. Now we're cramped in a small space, having to connect or communicate with our partners. And this can present several challenges. We had domestic violence situations probably rose. We have the verbal abuse. We have persons contacting the police for assistance. But during this period, it was very stressful and it contributed to, a lot of dissolution, a lot of persons having divorced, a lot of persons separating because persons now were asked to connect and communicate with each other. And that is something that persons seldom do with each other in a home. You come home at night, you're very tired, you care to the kids, you do the breakfast, you do the lunch for the next day, and we're just going on. Now we're asked to sit down in a home with a person that we probably never shared a meal with for a period of time, a person that we never had a conversation with over a period of time, and we're now asked to sit down. So these were some of the challenges. Persons wanted to go back to the situations that we were in before. Some persons had other relationships outside. So these were some of the challenges that we have now. Is the outside girlfriend going to call the phone the same way? But she can't because now you're home. You're not outside the shop anymore. You're not coming home from the gym. So these were some of the challenges that we found during COVID period where persons were not accustomed to staying in the home for that length of time with a person that they probably married for several years. They were accustomed to having a relationship, but not a friendship or a happy relationship. So these were some of the issues that came out of, observation with some of the clients that I've been working with, because now you're being faced with situations that you were not accustomed to, not having the skills and the knowledge to deal with situations that you are not accustomed to now communicating with. Now you have your children and your families, and sometimes there are extended people in the households as well. So these were all some of the issues that cause stressors in the home at this point in time. So it contributed to a whole other situation with respect to how persons communicate with each other.
One of the statements that was made in the chat was relative to the fact that it seems to have been placed on the back burner since COVID. People seem to have put HIV and AIDS on the back burner these days and act like it no longer exists. I know you probably found it interesting to look at a topic like this during this period, even though persons in the chat were saying, we're trying to figure out when you were going to speak specifically about relationships, as I would have said. But I heard what you did say. I heard what you did say about the relationship and the stressors of COVID, and there were experiences, and you brought to fore the incident about the young man who was arrested and was leaving one house to go to another. But the whole depression stage tends to set in as well during this period. I'm just trying to
go ahead.
Figure out how the whole mental, because it's a mental fatigue. People were starting to commit suicide. You had suicide levels rising. You had abuse rising, whether it was physical, emotional, or otherwise. And this was all impacted as a result of people being in one space for too long. And maybe not being allowed to have the sexual relationships that they would normally have had. Do you think that may have been a problem, a situation? If, a wife not constantly having her husband at home 24, now he's home 24.
24, yes. That was a major problem. And you recognize now we have finances as well, which contributed to that, because sometimes persons were not working, they were laid off. So that was an extra stressor. The economic situation in the country where persons were laid off, sometimes both persons in the home, like in the hotel industry or in the tourism industry, where you have like the airline industry where persons were laid off. That was another challenge. You had situations where men were under a lot of stress as well as women, because they felt like they were not, the head of the household no more. They were not the breadwinners anymore. But now you have women depressed because, I'm expecting the money, but I'm not getting it. You have persons not only catering to one home, catering to more than one home. So then you have now the clash of which home you're going to contribute to. These were all some of the challenges. Now you have children at home. You can't, some women may use that time to have other partners come over if your children are not at home. Now you don't have the space. You are in a house. You can't entertain other partners because you have your kids now on Zoom, and these are things. So you have issues. If I'm not entertaining the other partner, is that partner going to provide the financial support that he's accustomed to? Because he's, unfortunately, now there's no free space where he can come and connect with that individual. So you have a number of issues whereby sometimes people are challenged and they're faced with these depressive and suicidal thoughts, because here I am, when is this thing going to be over? There's no timeline of when it's going to be over. We had the lockdown, but now we don't know when it's going to be reopened again, that I can continue my life the way I'm accustomed to living it. I'm here with my wife, but I'm no longer in love with her. But because I had the opportunity to go and come whenever I wanted, now it was stabilized. But now, it's uprooted, because now I'm here forced to stay with this person that I no longer love and I no longer have feelings for, but I have to, because we're on lockdown and this is the home that I've chosen and this is where my children are. So I would have to operate within this space. So these are all some of the issues where depression comes in. Anger, because I'm angry right now. I want to go with the boys and here with this woman all the time. I'm here with this man all the time. I can't take him. These are all the things that I hear during the day. I stress, I frustrated. I can't wait to get out. I can't wait to break out. I don't want to be in here no more. When is this thing going to be over? Some people will leave home during the daytime and say, you know what? They say you can't go to the bread shop. I'm going for bread. You say you can go to the ATM. You say you can go. I'm going for these things just to get the chance to meet with somebody else. But in doing that, the risky behavior comes because you're doing it with a limited time frame because you need to get back home. Here's the curfew hours. So you can sneak out during curfew hours to make sure that I get what I want. I know I get my sexual activities with whoever I want because I need this little window, you know, to energize, re-energize, because I gotta come back into this house with this miserable woman who's crawling every day that I have no money. So these are all the issues that we are faced with during this time. But then the risky behavior continues. As you see, the gentleman said that in the papers that he had 2 females. He was evicted from one house to the other. So the other person probably didn't even know that he had 2 females until. So these are all some of the issues that we have. And they hear HIV and they're wondering, oh, what HIV? But it's as important as this, because if you're in a situation where you're so unhappy and because you don't have any financial resources, you know, it's causing you to be angry and depression, and there's depression steps in, more than likely then there's somewhere else that I want to be. There's somewhere else that can make me happy at this time. So I'm willing to try that other space that can fulfill my needs at this time. When my financial needs are not being fulfilled, my emotional needs are not being fulfilled. So let me go somewhere else where there's not the stress of children crying, there's not the Zoom, there's not the other person is always there willing to provide you with that level of love and comfort at this time. So let me just take a bit and just take a little chance to go here for a couple of hours to make sure that I'm satisfied. So these are all the dynamics that we would have during this period.
All right, I have a question. It says, I noticed the term STI are used no more than STD. What's the difference?
STIs, sexually transmitted infection, and one was disease. You know, the infections, the World Health Organization prefer the term infection than the term disease.
So that's really the difference. It's just
that's really the difference. Yes, it's a matter of just upgrading the terminologies.
I have a question here that says, what does AIDS and COVID have in common that give rise to erectile dysfunction?
AIDS and COVID-19. Okay, as a behavior change specialist, what they have in common. When the pandemic came about, we were at my office, we couldn't even believe it because we have the COVID-19 virus. You have the coughing, you have the colds. People went into the elevator, they didn't want to touch you. Sometimes you held your cough in the elevator until you got out. You didn't want to sneeze in the bank because as long as you sneeze, everybody just scattered. Same thing happened with when you have, people suspect you have HIV, you lost some weight. You might have a few lesions on the skin from probably diabetes or some other thing, and persons are not, want to be around you. Persons are suspected of having HIV. People let you to the elevator by yourself. Nobody wants to go to the elevator with you. Persons sit outside, probably the polyclinics, to see if somebody has HIV. That's why we're looking at decentralization, because persons just, they just sit there to find out in the clinic. Let me see, she got HIV, she getting really slim. I heard, it could be cancer, it could be some other situation contributing to that. So these are all the symptoms that were similar. We have an HIV pandemic where this was all across the world. We have it COVID now where it's all across the world. So these are major similarities between the HIV and COVID-19. We're looking at, she's asking about erectile dysfunction. Well, the HIV virus contributing to all these challenges, sometimes affecting the other comorbidities, causing erectile dysfunction, because you recognize after 50 years old, some persons may not be as sexually active as others because of these challenges. Your persons take Viagra and stuff to make sure that they're stimulated because they want to perform sexual, they want to still feel young. You're not dead, so you still continue, having sex with your partner. And persons usually do that same time with intergenerational sex or the transactional sex. And when you're looking at the erectile dysfunction, that is a part of life where the sexual transaction occurs. When you're looking at the COVID-19 virus, the person is still going to be the same 50. The person is still going to have the same challenges. It's just that this person has COVID-19. So they're just similarities with respect to where you are at in the age bracket. We looked at the 14 to 49 population, where persons are always catering to them. So we have all of these policies catering to the young persons, but we also must be mindful that there are policies that need to be developed for persons over 50, because the HIV spectrum is becoming broad and broad in other countries. And you know what happens to everybody else? As long as this sneeze, we get it, just like the COVID-19 virus. Things happen overseas, and then eventually they trickle down into this little lovely nation. So we have to be proactive, and we have to take preventative measures and steps to make sure that we guard ourselves with respect to all of these different challenges that can arise. We cannot always wait until they come. As a Caribbean nation, we have to make sure that we guard ourselves, to make sure that we protect our citizens.
All right, I'm going to read some stuff that is in the chat. One says, I think that a recent trend in sexual behavior is where older women are aggressively pursuing younger men. Another one that said the state of emergency can lead to an increase in domestic violence. The level of anxiety and uncertainty in the air can lead to distance with loved ones. HIV people are still treated like lepers. And the person said it all comes down to educating ourselves in the subject. Though that is pretty much what's in the chat. But the one that speaks about, and I think you raise it in your talk, in your thing where you talk about older men or older women.
Yes.
And the gap in HIV. I don't know if you want to say anything.
Yes, we look at.
You can put them in the chat, or you can raise your hands, and I will unmute your mic. Go ahead, Cecelia.
We looked at intergenerational sex. And, you have persons that are 10 years or older, be it male or female, having relationships. You see sugar daddies, you see the older gentlemen now with the younger women. Of course, I have the money. I have the resources that I can entertain the love of a younger woman. You see older women, they're not afraid anymore. I was doing some research, at community. And, I would talk to older women there, and they're not afraid anymore to be seen with a younger man. I hear things like, this is my pension, this is my money, I work hard, I can do what I want with it. I'm lonely, I need to have some relationships with somebody. They say that the children are gone and they're lonely in the house, and they raise their children as they're not being disrespectful by entertaining a younger man at this point in time, because they already raised their children and have their grandchildren. Why can't I now do what I want to do? And if a younger man is willing to love me the way I want to be loved, and I pay him for some services, why is that a societal issue? But these are all the issues. And we have things, for example, the gender challenges, because a person would be okay with an older man and a younger woman, but as long as the older woman in her 70s or 80s walking with a 30-year-old, it is frowned upon. So these are all even cultural issues and cultural belief issues that we have to work with in understanding the dynamics with respect to transactional sex. But then you have the other challenges, because the older women are not that au fait, or wouldn't be that au fait with condoms and the new condoms that we have in the market. That's why we have to make sure we always improve our programming, looking at negotiation of sex. How am I going to negotiate sex with a younger man, because I don't have the capacity at this time? Because in my time, these were not the major issues while dating, and now they are. So these are all the challenges. So that's how we look at transactional sex and intergenerational sex. And we look at persons, HIV positive, the age ranges that they have, and we're looking at tabulations and stuff like that, because we have to recognize that. And then this is where we are at in our society, and it can't be frowned upon. Persons 50 and older, they still have a lot to offer academically in our society. They still have a lot to offer socially in our society. So they have their choices to make, but we have to make sure in making their choices that they're given the information that they need to make wise and safe and healthy choices. Looking at discrimination, this is also a part. Discrimination and stigma. Can you discriminate or stigmatize an individual because of the age, because of their gender, because of their practices? No, we can't. There are laws and regulations governing how we conduct business in our workspaces. I wrote something for the ILO about HIV in the workspace. So there are laws that govern how we treat people as a result of how we feel personally about a particular matter. One of the questions we looked at was domestic, I think it was violence, and the issues surrounding violence. And that sometimes stems from culture, because we assume that, our males are dominant. We have a dominant society, a male-dominated society. So we would want then a submissive society with our females, but now they're getting more and more educated, they're getting stronger, you know, and the march is greater. And we want to make sure that, you know, we educate our men to understand, you know, the new changing paradigms that we're in with respect to our women and the roles that our women play in our society. And that these are all the issues that come out when we're looking at relationships, we're looking at COVID, and we're looking at HIV, because we're always putting on the girding it with COVID, because we're in a COVID society. So whatever we do, we have to make sure that we look at it from a COVID perspective until it's over, to make sure that we create our programs, because the programs that we used before the National HIV/AIDS Commission, where we didn't include COVID, would not be as important, because now we have COVID. So we have to change around everything to make sure that we connect our dots using COVID, so that we can make sure that we work with the COVID-19 environment, because there are changes in the COVID-19 environment. So we have to make sure that when we're looking at violence and stigma, discrimination, we're looking at our laws in schools, we're looking at the information that can be given, we're looking at educating our men, you know, about the changing paradigms with respect to dominance in the home, when we're looking at equal rights, when we're looking at all these things, empowering our women, when we're looking at our gender issues. We want to make sure that we do that, recognizing, hey, look, we're doing this now, but we're doing it in a COVID environment. So all of these are relationship issues that we have to work on to make sure that we build a healthy society.
Okay, I have a question from Dominions. If you can unmute your mic and go ahead and ask your question, please. Did I call your name right? Dominions? Could you go ahead and unmute your mic? Let me try to unmute for you.
Hi, good night. You're breaking up, but hello. Hello, you're breaking up. I can't hear you at all. I don't know if you want to write it in the chat. I can't hear. Uh-oh. Roseanne?
Oh, sorry, I was muted. So the other question, how do persons with HIV navigate being in a relationship that discloses their status with someone that is not infected?
Well, we have some of those right now. Persons usually use condoms, but we encourage counseling, you know, because that's a heavy load where one is infected and one is not infected. So there's constant, you know, HIV testing, there's constant counseling, there's constant support, you know, for each partner, the person who is not infected and the person who is infected. But persons decide and choose what they want to do in life. We can only give them the benefits and, you know, the negatives to the situation, and they make their final decision. And in doing that, we hold their hands the right through, because we want to make sure that we want to keep the other person, you know, at negative state. So we just make sure that we counsel them and we provide the, you know, the care and support needed to make sure the other partner is negative and the other partner is as healthy as possible, to reduce the levels of HIV in that person's bodies, to make sure that they, you know, they're very low in their viral loads.
It says lots of people are dying from the virus. What about talking about the masses ignoring these unnecessary deaths? How is loss of income affecting people's well-being? Lots more to address for behavior during COVID-19 contagious spread.
Yes, loss of income is very important because money is a very important topic in relationships. And you were in the house happy, everything is going fine. And as long as you're not working, then there's a problem. Can't pay the bills, then there's a problem. Can't give your children what they want, then there's a problem. And that's when people, they're depressed. That's when people go out because persons just want a little bit of happiness. And income is very important in a setting in a household. So I cannot have a session without talking about the benefits of income right now. We see sometimes it's suffering because of loss of work. Sometimes persons are losing their homes. When you lose your home, where are you going to go? Are you going to go in a safe space? Or are you going to go in a space that you get in a little, I think grandmother said, a little shelter? So you have to make sure that you have some place safe for your kids. You have something for them to eat. And sometimes persons are going into sex work because of loss of income. I work with a sex worker group as well, the women's empowerment group of some persons going to sex work. Sex work doesn't mean that they're going to the garrison or where persons are known to frequent. They're staying to their homes, they're getting into their cars, they're going to other houses, they're getting appointments. I saw something online the other day where somebody was given a location where they can be, where you can solicit them. Because things are tight, you have people putting things on Facebook and IG, saying, hey, look, I'm a prostitute and this is what I'm doing. So you have to be very mindful. I have sex workers that have children, so they still need to be taken care of. They're not in sex work, their parents are, but we still have to cater to our children. So it's very important to include finances when we're looking at all these things surrounding HIV. Yes, ma'am.
Do you believe that health and family life education subject in schools sufficiently addresses issues around HIV and AIDS?
It would never sufficiently address HIV and AIDS. HIV and AIDS is a big topic, and as I said before, it touches children, whereby parents sometimes, as I said before, loss of income may have to go into sex work and may bring some of the same practices into the home because they may have to use the home to be the hub for those issues. You have the teasing, you have the discrimination. I have some children that talk about persons, person is calling me the HIV baby because persons are, they're discriminated against. So we have those challenges. So then you would address those challenges. So we have the bullying. So HIV covers that as well. We have the gender issues. You have it from a religious point of view and a non-religious point of view, secular point of view. So we have that as well. So HIV covers then religion. So if we're covering it in our curriculum, then we have to deal with religion. We have to deal with HIV, gender for women, gender for men. So we have males, we have things targeting males, we have things targeting females. So these are all the different issues that we have to work with. We're looking at family life, and we're looking at biological development, and we're looking at how HIV can impact. We're looking at the emotional development to see how HIV can impact. So it's the physical, emotional. So sometimes, it's very challenging to have. That's why we have the transition to secondary school program at the National HIV AIDS Commission, where, we coordinate the program, and I go into the schools with a group of people. And we go into 2 schools per day, and we roll out this new program the first of the term for the first farmers going to secondary school. We look at sex, we look at bullying, we look at HIV, we look at gender issues, we look at the influences of music and certain things and certain songs, what is expected of you. These are all things that we do because we recognize that the curriculum cannot manage all of the information, and teachers don't have the time, and we don't have the resources to do all of this. So we have probably the substance abuse, the counseling of substance abuse will go in and do their bit. I have persons from the University of the West Indies doing gender. I would do HIV, or persons would do HIV. We have things about disability. We have cartoons. We have a variety of things because we recognize that the family life curriculum cannot hold all the information because, you know, every household is different. So we make sure that we bring as wide the balance, as wide the spectrum to make sure that everything is covered. And in doing that, then it goes over the curriculum so that the persons would not be able to get in their usual day-to-day tasks. So that is a challenge, yes, but we have persons coming into the schools to make sure that they meet the needs of the heavy demands of family life.
Okay. The person said they would like to hear what the speaker thinks about one size fits all for lockdown, regardless of what the vulnerable group face. She said there's too much general talk about specifics. There's too much general talk and need more specifics about strategy used to contain the disease.
Go that again, please. Pardon me. Go for that again.
The person wants to know strategies that can be used to contain the disease.
HIV?
HIV.
Okay.
Well, yeah, it would have to be specifically HIV because the person talking about lockdown and the vulnerable groups.
Oh, okay, fine. Strategies used for my vulnerable groups. My vulnerable groups for the lockdown this year, we had the sex workers and we had the persons, the ex-convicts from prison to make sure that, you know, their needs were met. We have the prison fellowship group in Carlton Village, located in Carlton Village. Director is Neil Dowden. And we worked together we had a lot of help from First Caribbean Bank. I want to say thank you to the director, Miss Law. She was really instrumental in providing funds to make sure that persons were given, for example, hampers during this time, because they were given food vouchers and they were assisted with emotional support. We have persons still coming out from prison because they had some early releases, and both male and female. And we got some help too from the Kiwanis Club with hampers for our kids, you know, things that we could share with the persons in the hospital, any young ones in the hospital and the young mothers. So those were just a few of the donations that we had. So we worked with the sex workers as well. I also shared some of the hampers because the prison fellowship would assist me with my sex workers, and my sex worker group would assist in helping. We had donations from overseas, whereby Mr. Christopher Harper, he got some donations from some persons in England. They sent $250 vouchers for some of my sex workers to make sure that they were up with their rent because they were now not able to go on the streets. So we made sure that they were able to pay some of the rent with the money and buy things like bottled gas and things that they needed to just assist them during this time. We provided social and emotional support for them. Maybe we have a chat. I have a chat with them so that I'll be able to connect with them on a daily basis. As soon as the morning opens up, I contact them. Hi, how everybody doing? Everything is fine. And we would provide support, emotional like that, with limited support because, you know, I can't go out because it's on lockdown, but I still make sure that I have a relationship. But this relationship didn't start in lockdown. This relationship started way before lockdown because you just can't wait until there's a crisis to begin to connect with your client. I connect with my client on a daily basis like this so that when there's a crisis, then it's just smooth sailing for us. This is something that we do on a regular basis. So we make sure that we tap in, and the Ministry of People Empowerment, they were giving donations out, and our minister and our permanent secretary, Gabrielle Springer, made sure that, you know, these hampers were given to our most vulnerable population. So we took care of that at the Ministry of Social Care and People Empowerment.
I'm not sure that you would have the answers to this particular one. The person is asking about numbers, how many unemployed, how many privileged, where are the beggars, how many unemployed, and how many are hungry. I am not sure that you...
No, I don't have the numbers for the unemployed, but what I can say is that our strengthening program at the People's Empowerment, we were the program that started by giving the $600 vouchers before it was transferred to the Prime Minister's office. And we still continue to give referrals, and the Ministry of Social Care, we still continue to give the referrals. Some come to the National HIV AIDS Commission, and we refer to welfare as well, which is also under our ministry. And we also make sure that we assist wherever we can, because we're also given donations, and we try to see how we can assist as many families as possible. With respect to beggars, persons just come into the National HIV AIDS Commission. We don't advocate it because, you know, you have the food food bank and be our policy. However, in order to write policy, we have to connect with persons on the ground. So sometimes we encourage persons around the area to come, and they come and we connect and dialogue with them so we can see what their needs are with respect to HIV. And sometimes it's not even HIV related, but we don't want to wait until you are HIV related to have a conversation. We want to start this conversation before crisis arise because we're proactive within our ministry. So we make sure that their needs are met, that we can talk to the persons on the ground. We can talk to the gentleman who sits outside every morning with the garbage. We want to make sure if his needs are met, you know, how best we can refer him to the psychiatric hospital. We want to encourage him to come in. We educate our security guards in our building to make sure that just in case our sex workers come straight from the streets into our ministry to access condoms, that they're not stopped. And, you know, we want to make sure that they understand, you know, where we are at as an organization, the National HIV/AIDS Commission. So we educate our security guards, and they're partnering with us successfully. That's one of our stakeholders, to make sure that they encourage our sex workers and they feel comfortable when they're coming to the National HIV/AIDS Commission to access condoms, access literature, you know, to get information, to look at, to see how they can get HIV tests, to see how best we can work with the kids. So we make sure that we meet the needs of our population by using a holistic approach to our stakeholders. And I just remember the lady's name at First Caribbean Bank is Miss Whitelaw. Yes, Miss Whitelaw, Mrs. Whitelaw. Yes, please.
Someone said, I know in Canada, many medications may be covered, but what about people with HIV there, assuming in Barbados, but that may not be able to maintain their medication, or is it covered?
Well, the government of Barbados provides free medication for all. For all. So even if you are not a citizen of Barbados, we still afford you that, you know, opportunity to get medication, because we want to make sure that our citizens are safe as well. So it's not about catering to your own household, it's catering to the environment around you. So we do that as a government. We make sure that the medication is free so that you can receive, you know, care. As a member of our CARICOM nation, we make sure that we try to, you know, provide this medication for all so that they can, you know, stay as healthy as possible while they are living or working in Barbados.
Do you think that Caribbean countries are doing enough in terms of migration patterns and security matters, where migrants come into countries to check them for HIV/AIDS? So there's a border control. There's a border control.
Border control, yes, that's the border control issue. However, what we do here is that our polyclinics provide the service, and our hospitals, that if you are faced with any challenges with any comorbidities and what have you, you know, we are always willing and ready to assist you if you are HIV positive. I feel that if you're HIV positive, you get special treatment. This is my own opinion, because we are always there to meet your need. You know, I have clients who are HIV positive and they may not be Barbadian, but we are always here to meet the needs, because we recognize that as long as you are on our island, you are a family. So if you're a CARICOM nation, you are still our family. We are one Caribbean, you are a family. And if we don't recognize them as such, then they can go underground and they can meet other members of our population, or transmit the HIV virus to other members of our population. So it is advisable that we embrace and we try to understand where they're at, and we try to meet their needs, specifically with respect to HIV medication or counseling, because we want to make sure that our populations and Barbados are as healthy as possible. If it's our young, if it's our old, we want to make sure that they have all the resources to have a healthy life.
I don't have any other question, but I just want to say it is interesting that we can speak about topics like this now, which was before a taboo topic, and persons would never talk about HIV. People would never talk about sex and stuff like this. And the discussion has been one that has brought a lot of thought in terms of HIV and AIDS, COVID-19, and the whole relationship. So I don't have a lot, I don't see any more questions. What are some of the stigmas? Yeah, I have one. What are some of the stigma around those living with HIV and the workplace impact? Which is an interesting question.
Yes.
Go ahead.
Yes, I wrote an article for the ILO about that a while back. Some of the things we have would be like, you don't want to use the same telephone. They wipe it off 1,000 times before COVID. You know, you don't want to use, some people don't want to use the same mop bucket. Let's say the maids, they have different maids on the floor. Persons don't want to sit in your chair, so you have a chair. And then when you leave to go on vacation, somebody will push your chair away and bring a chair for the temp. You know, these are small things that people do in the workplace. That's why it's good to have good human resource and good personnel officers that can step in at this time to give, you know, education, call any persons from the National HIV/AIDS Commission, so we can give them the education, so we can meet their needs of the people in your agency. You know, I remember having an individual where, you know, you finish university and you first time on human resources and you've gone to a job, and then let's say you have a person with HIV. First week of your job, what are you going to do? If you never had any HIV training, then you are caught napping. So that is why it's good to call us in, to let us, you know, work with you at your pace. We are not intrusive. You tell us what you want. We sit like any other meeting, you tell us what your needs are. You know, we don't target specific groups, but we come in and we work with you at your pace. We have our music, we have our cartoons for our kids, we have our different segments. We work with persons in administrative labor, the persons who go out to pick the fruits in the farm labor program. We work with them. You know, we work with the schools. We work with churches. I work with Anglican churches. Everybody Anglican churches, my biggest supporters. We go to different Anglican churches in Thomas. We work with Trinity Anglican Church. When the bishop, he was the reverend there at that time, Bishop Michael Maxwell. We work with Covington College. We work with all the youth, the Barbados Youth Service Corps, I think that's the name of it now. And we work with all these different agencies to make sure that we target different populations with our preventative measures and our preventative strategies. And that's what we do at the National HIV/AIDS Commission. So you are free to call us in whatever sphere. We can come to your churches, we can come to your youth groups, we can come to the universities, we can come to the banks. We really meet to your needs. So we find time to connect with your audience, even if we connect with them 5 persons at a time, to make sure that we don't take too many workers from, you know, their daily tasks. But we're here to provide this level of education that is necessary, that persons may not want to hear. That is why you have to infuse it with other things. So when I come to your workplace, I may not always do HIV. I may do some form of work-related issue fusing HIV, because as I said before at my introduction, is sometimes a hard pill to swallow for employers and employees. So we have to find a way to get the message across as creatively as possible, but still getting our message across to our population. So we have to be very creative with each population, because if I'm going to queue in the community, that's where music is, and I can't use the same creativity that I'm going to use with the schools. I can't use it at the churches. Sometimes I have to go into my areas at church knowing the Bible, because when I go, I can't go to the Mothers Union where persons are 50 and over and talk about condoms initially, or talk about anal sex. I have to start with something religious, something dealing with God, so that they can be comfortable enough to see where I'm at, to understand. And after I go in then and I meet your needs, then are you willing to understand where I'm coming from? And that's how sometimes I have to triangulate all my different methods to make sure that I meet my specific targets, because HIV is a topic that is not easily or readily embraced by members of society, but it is here.
I have two last things. Gertrude says, thanks for the informative and enlightening presentation. And then Kathleen says, you're talking as if funding in Barbados is bottomless. Is that true? And we know that funding in Barbados is not bottomless.
Well, I don't know if it's bottomless. What I say is that right now we are in a pandemic and we're in a crisis, and we will not be able to receive the level of funding that would be afforded to us. Generally speaking, we all have to cut back in our homes. We're cutting back in our schools. We're cutting back in every area of our lives. We have to cut back. And I know that the government is trying their best to see how best they can meet our needs, but we must be mindful of all of the challenges. For example, you know, before the session started, it was trying to speak to Roseanne to see how best we can help the students in St. Vincent. Yes, we're looking at hampers. We're looking at sending clothes and water, but the students who are enrolled at university now, if your mother's house is demolished or there's a landslide there and your daddy's not working, and then there's a bank loan to pay back, you know, and then you have to build your house. Are you going to focus on your kids, or are you going to build your home back? So there are all different issues that we must navigate in this COVID climate, that we have to make sure that we are creative with our spending. We have to make sure that we are creative in our content, and we have to make sure that we are using dynamic approaches to meet all of our target populations for which we are, because, you know, I think that this is a very creative way that we are doing to get our message across, and we're getting our message across different spaces that we would have never been able to reach before, because if we would have prepared something and it was not before COVID, it would have just been University of the West Indies. So this is another means of another way of being dynamic and creative with our approach to HIV, and infusing it in other areas, so that we can, you know, make a whole pot of interest to the public respect to HIV and the other issues that surround HIV, because it does not stand alone.
Okay, the participant says, awesome presentation, well informed with great behavioral change strategies, and coping skills. Another one said, thanks for the presentation, very informative. And I think this is the right time for this conversation. I want to say thanks very much to all of you who have joined us this evening. It has been a very informative evening, as you have said. I want to specifically thank Cecelia for taking time out of her busy schedule to present her topic with us this evening. I want to thank my counterpart at the Mona campus, Karina Dice, and to you participants. If you were not here, we would not have been able to have such an engaging session. I want to say thanks also to the UWA Alumni Association Barbados chapter, who hosts this session, this series. This is the last in the series for that session. But we have another one coming up from the CAFL campus again, which is on June 3rd. It speaks about from graduation to retirement, and it's being done by former senator in the last Barbados administration, Maxine McLean. I ask you to join us again. I think we also have another one next week. Karina, if you can give the topic for next week. I cannot remember which one that is, but we are glad to have you joining us for these webinars. It has been some very interesting topics. And if you as an alum or anyone who's here with us who have a topic that they may want to share information with us, you are welcome to do so. We look forward to having you to come and share your perspective as well. So we thank you very much, and we really appreciate it. Everybody says good session, Celia. I really appreciate it. Dario, thank you for coming in this evening.
Thank you, Dario.
Very much. I appreciate all of you, and I want to say have a blessed good evening, and whatever you do, be safe out there. Good evening.
Thank you. Good evening to all. Bye, Janice. Bye, Melissa. Bye, Joseph. Good night. Bye, Lisa. Bye. Have a good night, Lisa Hunsberg. Miss Alexandra, good night. Ronique. Thank you, Dario. You're welcome. Hi, Joycelyn. Thank you for coming. Hi, Aaliyah. Good night. You're welcome.